In normal dogs, the gallbladder is the only part of the biliary system commonly seen on ultrasound. In dogs, the stomach extends across the ventral midline and usually blocks the view of the cystic duct of the gallbladder and the common bile duct. Normal gallbladder volume in dogs is usually about 1 cc per kilogram of body weight. Enlargement of the gallbladder in dogs suggests obstruction of the gallbladder itself or of the gallbladder and the common bile duct. Visualization of the common bile duct on ultrasound in a dog suggests current or previous extrahepatic biliary obstruction. This video shows an overfilled gallbladder in a 12-pound mixed breed dog with severe acute pancreatitis. The cystic duct is dilated and visible in this view. Gallbladder volume was expected to be 6 cc's, but was measured at 14.6 cc's. In cats, the stomach usually ends at the ventral midline, and the gallbladder, cystic duct, and common bile duct are commonly seen. The gallbladder in cats usually contains 5 to 7 cc's of bile. Gallbladder volume of 10 cc's or more is considered to show obstruction in cats. The normal common bile duct should not be greater than 3 to 4 millimeters in diameter. This video shows the normal gallbladder, cystic duct, and common bile duct in a 6-year-old neutered male cat weighing 13 pounds. The ultrasound exam was a recheck of a stone in the urinary bladder. Note that the common bile duct does not show color with color flow Doppler. This video shows the gallbladder of a 15-year-old spayed female cat weighing 6 pounds. This cat has acute pancreatitis with extrahepatic biliary obstruction. Cats with biliary obstruction usually have a strong and persistent contraction or spasm of the gallbladder wall. This causes pain and usually results in a rounded but not enlarged gallbladder. In one study, less than 50% of cats with biliary obstruction had gallbladder enlargement. Note the double wall of the cranial gallbladder suggesting edema or mild effusion. The large cyst-like structure caudal to the liver is a bile cyst in the main body and left limb of the pancreas. Strong pressure of gallbladder contraction has caused a bile leakage into the pancreas. This video from the same cat shows the enlarged common bile duct near the duodenum. The common bile duct does not show color with color flow Doppler. Intrahepatic bile ducts, too many tubes, are not seen around the cystic duct. In dogs and cats, the common bile duct will enlarge first. 5 to 7 days later, the intrahepatic bile ducts enlarge. Intrahepatic bile ducts are not normally seen in dogs or cats. Enlargement of the intrahepatic bile ducts indicates a current or past biliary obstruction. On ultrasound, this is known as too many tubes, as seen below the cystic duct in this video. Note the hyperechoic liver parenchyma surrounding the dilated intrahepatic bile ducts in this transverse view of the liver of a dog with extrahepatic biliary obstruction. Bile is produced by the liver, but flows to the duodenum to help digest fats. Retention of bile within the liver causes liver damage. Dilated intrahepatic bile ducts do not show color with color flow Doppler. In this video, the color is in the blood vessels beside the intrahepatic bile ducts. Dilated intrahepatic bile ducts have hyperechoic walls on ultrasound and look like intrahepatic portal veins. Note that dilated intrahepatic bile ducts do not taper smoothly like intrahepatic portal veins. The bile ducts appear rough and irregular. Once the obstruction is cleared, total bilirubin will return to normal. However, the dilated bile ducts may or may not ever return to normal size. If total bilirubin is elevated, the obstruction is current. If total bilirubin is normal and the patient is asymptomatic, bile duct ectasia is present. With intrahepatic biliary obstruction, the liver is usually enlarged as shown in this video of a cat with hepatic lipidosis. In both dogs and cats, the total bilirubin will be elevated because swelling of the liver parenchyma is obstructing flow from the liver to the bile ducts within one or more of the individual liver lobes. In dogs, the gallbladder may appear normal or small. In cats, the gallbladder and common bile duct may seem normal or small. Bile is not flowing to the gallbladder or common bile duct. In porcelain biliary tree, bacterial infection within the hepatic bile ducts causes hyperechoic crystal or stone formation within the hepatic bile ducts. The bile ducts will not show color with color flow Doppler. If bacterial infection is current and active, the ALT will be elevated and the patient will be anorexic, lethargic, and depressed. If the infection is cleared by long-term antibiotic treatment, 4 to 6 weeks, the serum ALT will return to normal and the patient will be asymptomatic. Multiple ducts are usually affected. Fine needle aspiration of the gallbladder or a dilated bile duct can be used for culture and sensitivity testing. The stones will show acoustic shadowing. The stones can obstruct bile ducts in the liver, leading to rupture of bile ducts and bile peritonitis.